join. We were expecting some others, so some others just may hop on in a little bit. So why don't we go ahead and get started? So again, I want to welcome those that are with us this afternoon here at roughly lunchtime. As I mentioned, my name is Peter Carey. I'm Executive Director for the American Heart Association for the New Jersey region. I just want to welcome you to our rally day for the Jersey Shore, Central New Jersey CycleNation event taking place on May 26th. This will be a digital ride experience. We'll all be riding where we are. This event, if we were going to be holding it, we would actually be on the boardwalk in Asbury Park, riding, looking at the ocean. So we all want that. I know we all want to be back with people. We all want to be back live. So next May, we are so hopeful that we will be on the boardwalk at dusk in Asbury Park, enjoying CycleNation, seeing the sunset and looking at the ocean. So you can see our agenda there. We have a very, very special couple of guests with us. Stacy Quinn, she is a survivor ambassador, a volunteer champion with the American Heart Association, a stroke champion. She will be sharing her personal story of resilience and courage and recovery with stroke. Lisa Lee from EZ Ride will be sharing with all of us some safety tips for safe riding, whether pandemic or non-pandemic. And then we'll just go through a little bit of information in our digital event guide, and then answer any questions about the event, which will be taking place 2 weeks from today. So, and I want to also thank we have a local sponsor. Gomo Health is the local sponsor of the Jersey Shore CycleNation event. So with that, I would like to turn it over to Stacy Quinn to please share with us her personal experience and story.
Hi, Peter. Hi, everyone. Thank you so much for having me today. I'm super excited to be pedaling my heart out with you to raise awareness of stroke, as well as money for life-saving research. If it wasn't for research, I wouldn't be here today sharing my story. Next slide. So hopefully you all know that May is American Stroke Month. We observe this every May. And what we really want to do is focus on the serious nature of stroke, raise awareness of treatment and prevention, as well as ensure that survivors and caregivers get the support that they need. Next slide. What I'd like to share with you today is what I call my stroke of hope. I use my experience of stroke to raise awareness of stroke symptoms and prevention with the help of saving lives and supporting survivors. And after my talk today, if you want to learn more about my story, you can visit my website, www.mystrokeofhope.com. So next slide, please. So when people think of stroke, they often think of this, and this is what you see when you Google, is older people. That stroke is something that happens to older people. In fact, when you Google, this is what you see. These are the images. Next slide. What you don't think of is the image here. And I didn't think of it until it happened to me. But what I did not know is, according to the American Stroke Association, 1 in 5 women, that's 1 in 5, will have a stroke in her lifetime. So me and my friend Jamie, pictured here, we just happen to be the 1 in 5. So next slide, please. I was someone who worked out every day. I ate healthy. I did everything right for my health. So I didn't think about stroke. In fact, I thought the most likely thing that could happen to me was getting a cold or the flu. I was doing everything right for my health. Next slide. But that all changed in the blink of an eye when I got what I would call is the worst headache of my life. I flash back 6 years ago. My day started out like any other. I got on the train, headed to my job in New York City. But the one thing that was different is I had this pounding headache. It was terrible. So I decided that if I ran into the coffee shop across the street from work, got some caffeine, that things would get better. Next slide, please. Because, like everyone, I had a busy day and I didn't have time to worry about this headache. I had a meeting with my new boss. I had a lot of projects to complete. But as I sat there sipping my coffee, going about my day, things started getting progressively worse. The headache increased. My stomach was upset. My vision got a little blurry, but I had a lot of work to do. So I just kept going. Next slide, please. Then in the meeting with my boss, for the first time since I was a little girl, I couldn't string together a sentence. What I was saying made no sense. My boss asked me if everything was okay. And as soon as my speech was garbled, it returned back to normal. It was really quick. So I thought, okay, this is a side effect of the headache. I paused, but then it happened one more time, couldn't put together my words, and then everything returned to normal. So, I thought it was a side effect of the headache. After the meeting with my boss, I consulted Dr. Google, and my search came back was that I had a migraine. But the one person that I should have listened to that I didn't was my mother, because mothers always know right, always know best. When I told her what happened to me, she said, "You're having a stroke. You need to go to the hospital." And if you knew my mother, she's a little bit crazy, tends to overreact. So I said, "You know what? I'll just go to urgent care after work tonight." Next slide, please. So I went to urgent care that night, and the doctor looked at me. He's like, "You're fine. You have a migraine. Here's some medicine. I'm going to send you on your way." I was like, "Okay." Then I went home. I filled the prescription. Things didn't really get that much better. We're about a couple days later, and now my ear is killing me. So I go back to the same urgent care facility, and the woman's, kind of tells me, "You're stressed out. You have this headache, and now you have an ear infection." Gave me eardrops. Home I went. But I have to tell you, next slide, please. 10 days later, after this episode in my boss's office, the headache is still there. And I feel like my head's going to explode and I can't live like this anymore. So I found a neurologist, this gentleman pictured here, went to I begged his assistant to get me in that day, walked down from my office to his office. I was a little taken aback because the office just wasn't very organized, or seemed not as clean to me as I would have liked it to have been. I almost left, but something told me to stay. And thank God I did. This man saved my life. He looked at me and he said, "You know what? I leave no stone unturned. While I don't think there's anything wrong with you, we're just going to send you for some tests, a scan of your neck and your brain." I was really busy at work and I had personal training at the gym that night. So I was like, "I really can't go tonight. Can we put it off a few days?" And he said, "You know what?" He's like, "I'll let you put it off one day, but that's all." So the next day I go and get the test. Next slide, please. And then within hours, my phone's ringing and it's the doctor. So I'm thinking it's not good. I have a brain aneurysm. There's just something not right that he's calling me that quick. And there was something not that right. He told me I needed to get to the ER immediately. There was a team waiting for me and I was in danger of a catastrophic stroke. It's like, wow, I wasn't something I anticipated. Next slide, please. I did get to the ER as soon as possible, and he was right. There were people waiting for me at the front who ushered me back as soon as I got in there. And that's where I learned. You see it circled in this picture. I have what they called a carotid artery dissection. Your carotid arteries are the main pathway from your heart to your brain. Mine, there were like 3 layers of tissue. Mine kind of broke and blocked the blood flow by 90%. So I only had about 10% blood flow on that one side of my body and was really in danger. They said at the hospital I was probably a few hours away from the stroke that would have killed me. Next slide, please. Um, as I was laying in the hospital bed, I have to say, I was kind of wondering, why me? I did everything right for my health. Neurosurgeons, neurologists, and medical students were in and out trying to figure out what to do with me. Um, and next slide, please. And that's when I learned that 1 in 100,000 people every year have something called a spontaneous carotid artery dissection. It happens for no reason at all. And actually, I have to update that statistic because I was recently doing some research for my website and is now 3 in 100,000. And we don't know why. And that's one of the reasons that we really need research. I'm very lucky. I had a positive outcome. I left the hospital surprisingly with some medication and some restrictions that I have to follow for the rest of my life. But thanks to a doctor who leave no stone unturned, I'm here to share my story with you. Next slide, please. And just a couple of lessons I want to share with you. What you might not know is women have more strokes than men, and stroke kills more women than men. As I mentioned, 1 in 5 women will have a stroke in her lifetime, and that's not something we hear a lot about. Next slide, please. My other message to you is you need to be the CEO of your own health. It can save your life. You know, looking back in the days leading up to my stroke and things that had happened to me, I kind of felt as though something wasn't right, but I ignored all of the symptoms. And I should have known in my boss's office when I slurred my speech, there was something really wrong. I needed to get help. I think that none of us want to believe that something bad like that is going to happen to us. So we kind of talk ourselves out of it. But you know your body better than anyone else. If something doesn't feel right, seek medical attention. Next slide, please. And one thing I want to do is I want to leave you with an important message that we all can be stroke heroes. But unfortunately, studies show that fewer than 1 in 10 people know what the letters of FAST mean. And this is an acronym about stroke symptoms. So next slide, please. So I don't want you to be the 1 in 10 people who don't know. So I want to walk you through these. So the common stroke symptoms are F is for face. Does one person's side of their face droop? Ask them to smile. Is it crooked or uneven? That's a sign of a stroke. A is for arm weakness. Is one arm numb? You can ask the person to raise their arm. Does it drift downwards? That's a sign of a stroke. Speech difficulty, that's what I talked about in my story. You know, if you think someone is having trouble speaking, you can ask them to say a certain sentence like the sky is blue. If they can't do that, that's a sign of a stroke. You do not need, this is important to know, all of these symptoms, just one, to know it's time that you need to call 911 and get medical attention quickly. What's not on here is the onset of a sudden severe headache like I had. If you ever have what you think is the worst headache of your life, get medical attention immediately. And I think what's important to note here, do not drive yourself to the hospital. Call an ambulance because they can start treatment quickly in the ambulance if you are having a stroke, and time is really important. Next slide, please. So I'm excited that you're all riding with me in CycleNation for research. The money goes to research, and without that, I wouldn't be here. So thank you so much to all of you. And now I'll turn it back over to Peter. I think you're on mute, Peter.
Yeah. Thank you. Thank you, Stacy. No matter how many times I hear your story, it's just amazing. And we say this to you all the time. So for those that don't know Stacy, she truly is one of our most amazing, I'll say, regional and national advocates and champions for stroke awareness. She just is so active, so visual, as well as with our women's movement, Go Red for Women. It's really a story of courage and resilience and recovery. So she makes it her cause in a way to be visible and tell the story and try to impact people's lives. So I just want to say thank you very, very much. So we at the American Heart Association, American Stroke Association, we have identified from now through 2024, 5 high-level community priorities. And one of them is our continuing priority on women's health. And within women's health, there are 5 different areas that we'll be focusing on. And one is women and stroke, which really is what Stacy was alluding to with the statistics that more women than men have stroke, more women than men die from stroke, and then the 1 in 5. So we're making a passionate commitment. We've been doing it, but we will be escalating and elevating awareness and attention. And it's happening right now in May. It's happening right now in May across the country. We are focusing on women and stroke. So thank you, Stacy, for sharing and reinforcing those critically important messages and sharing your story. So with that, I would like to introduce and turn this over to Lisa Lee from Easy Ride. And Lisa, thanks for reminding us to record this, because we will we will share the recording out to our whole audience. We will share the recording out to our entire audience that's involved in CycleNation that came with us here today. So thank you for that reminder. So I'm going to turn it over to Lisa, who's with us today, to just share with all of us that cycle and ride, some things to think about when we're on the road, some safety tips for cycling. So Lisa, I'll turn it over to you. Thank you.
Thank you, Peter, and thank you, Stacy, Lauren, June, and the other person for allowing me to share. And, you know, Stacy, I'm so touched by your testimony. My grandmother, my maternal grandmother, actually died. She had many, many little strokes, and she had high blood pressure. So it's a good reminder to me, you know, that it's kind of, it can be genetic, and that I need to really take care of myself and make sure I keep getting enough exercise. So thank you so much for your testimony. It was awesome. So you can go to the next slide. So it's COVID-19, and there are so many wonderful benefits of cycling. I know that everyone knows some of these things, but you know, you can reduce noise and air pollution. We can reduce the amount of congestion and traffic and the need for parking. We have way too many cars here in New Jersey, honestly, driving all over the place. So the more that we can cycle, whether it's to work, for recreation, or even just for exercise at home on a stationary bike, it's a good thing, right? So cycling reduces car maintenance and all of those costs associated with driving, so we can help to save money. We can build our strength and our fitness and keep ourselves healthy. As a way to prevent high blood pressure and chronic diseases. Cycling also helps to reduce our stress. And I know that stress can be a great cause of stroke and high blood pressure. So the more that we exercise, the more that we have aerobic exercise, the more we can be healthy ourselves. It's also a way to maintain or lose weight, and also to keep our joints healthy. It's low impact exercise. And as someone who has rheumatoid arthritis, cycling is much easier for me to do now than jogging, like I used to run. Next slide. So one of the things we need to be careful of is we still need to keep ourselves safe. Even though I'm fully vaccinated, I wear my mask outdoors. I know that there has been guidance that it's no longer needed, but I just think it's a way to be respectful, show that we care about others. So I suggest wear a mask if you haven't been vaccinated, especially to show your care for other people, and keep distance. So if you're not riding with people in your household, we recommend that you stay 2 bike legs apart, because we know COVID-19 is airborne. So you can count to 3 before you start riding, but this is a good thing. Next slide, please. One of the key things you must do when you're cycling outdoors is to make sure you have the right equipment. So one of those things is to have your helmet. Although they're only recommended in New Jersey for those 17 and under, we recommend that everyone wear them, because there is so much traffic on the roads. Our roads are narrow. We don't have a lot of bike lanes yet in New Jersey. And I say yet because I'm hoping that there will be more, but make sure you have your bike helmet. We recommend gloves for your hands, like the ones shown, sneakers, bright clothing, and long pants if you're doing mountain biking. You can go on. New Jersey, some people don't know this, you're required to have a bike belt, right? So bicycles are considered vehicles by New Jersey law. We have to follow all the same rules, and we have all the same duties as drivers. So we need to let people know. We can either use our voice by saying passing on your left, or use our bells. And we also need to have lights. So you need to have a white headlight on your bicycle and a red tail light on your bike. And you can see I put more lights on my bicycle that's behind me so that I'm more visible. Visibility to drivers can help to save your life, because a lot of times drivers don't see us. So please remember to have these pieces of equipment if you're out riding on the roads. Next. Also, I'm wearing some bright clothing. So I've got my big yellow reflective vest. The other thing you want to do is make sure your bike is ready before you go out for a ride. We call it the ABC Bike Quick Check. A is for air, just make sure you squeeze your tires, make sure they're hard. Check your brakes to make sure that they're in good working order. Maybe every once or 2 years, you should change your brake pads. They can wear down just like they wear down in your car. Make sure your chain is not rusted, and that it's, make sure that when you're riding, you don't try to change gears when you're not pedaling. That's how your chain often pops off. And then in general, make sure those quick release levers, like the bottom left-hand picture, make sure that those are closed. I've met many people who adjusted their seat or took their wheel on and off when they were out, popped it back in, and then they didn't close that clasp tightly, and then they got into a terrible crash afterwards. So make sure those are tight, and then just do an overall ride, a short ride before you go out for longer rides. Next. Again, like I said, we have to follow all the same rules as drivers. So that means we have to stop at lights, at red lights and at stop signs. And we should also wait until we get the walk signal to go. What you may not know is that cars oftentimes have the same go signal. They have green when we have walk. So if you just assume that you can go without looking around, make sure that you look over your shoulder both ways. Make sure that you check cars coming forward and that you're communicating with the cars so that they don't turn and run right into you. Make sure you push those buttons so that the signals will go for you and give you more time. All right, always ride right. We say ride right, walk on the left. So like a vehicle, bicyclists have to ride on the right-hand side of the road with traffic. If you are on a very scary road, we always say, you know what, it's okay to get onto the sidewalk too, because there are a lot of roadways here where cars are going fast and they don't give way for cyclists. So remember to ride on the right with traffic. We've seen horrible collisions when people rode on the left and a car made a quick right turn and they had a head-on collision. So please, please always ride on the right with traffic. And that's why it's important to be visible. If the cars can see you in front of them, they won't hit you. Next. And in summary, the 5 B's of bike safety that we're reminding you guys about is please be safe. Keep those bike links between your riders, wear your bike helmet, wear your mask, be seen and heard, bright clothes, use your bell and your lights. And remember, use your left arm to signal and communicate. Your left arm is recommended because that's the arm that the cars are going to see. They're going to be behind you, coming up on your left-hand side. So if you use your left arm, you'll be more visible. Remember to be careful, always stop, look, listen, and wave at driveways and before crossing streets. 30% of cyclists get hit actually coming out of their driveway. We forget that cars that are coming down the road can't see us starting to ride down. So stop at the edge of your driveway, look both ways, make sure it's safe before you head out. And remember to be alert. Don't be looking or talking on your phone. Don't be listening to a podcast or music as you ride. You need to have all of your senses fully engaged with traffic so that you can see what's happening and watch out for hazards on the road and make sure that the drivers see you. I always suggest give a wave before you cross, before you head out, so that the drivers, really are able to see you and know that you're there. And then again, be predictable. This means riding straight, not weaving back and forth in and out, riding on the right with traffic. And remember to always check back, signal, and then before you do any movements like turning or signal before you stop even, because if cars don't know that you're going to stop and you're in front of them, give them that stop signal about 20 feet before you get to the stop sign so that they don't run into you. So, okay, thank you. I think that's it. You can go to the next slide, but you can check out our website if you'd like. We have all sorts of different videos and resources for cyclists as well as for pedestrians. Thank you to the American Heart Association, and happy Stroke Awareness Month.
Thank you, Lisa. That was great. Stacy and I both put in the chat that we have to get bells. We have to get bells for our bikes. I hadn't heard that. It's great information, great tips, some of which I've not heard before. So thank you very much. And thank you for sharing your personal story too, So thank you. June had a question in the chat box about the need for or pros and cons of a rear view mirror on the bike.
Sorry, those are helpful, but in the same way that you don't just use your mirrors when you drive, right? It's important to also scan back, because using your mirrors, it still just gives you a limited, visual area that you can see. So the best thing is really to do the full turning, especially if you're going through parking lots. You know, you can't see with a mirror someone who's coming from, you know, either side, that direction. So I would say scan, but yeah, mirrors are fine. They're helpful, but don't rely on them only.
Yeah, that's great. Thank you. And I put in the chat box, we've been, through our government relations team and others, we've been working for a number of years in New Jersey on the idea of complete streets. And so we've been championing and advocating for more safe, well illuminated biking and walking paths in New Jersey. That is something that's near and dear to us. So we also hope to see more and more of that coming to, like, I sometimes go out to Cape Cod, and I love the conversion of railroad tracks to the trails in Cape Cod in particular. So, but just FYI, it's one of the things that we support here in New Jersey as well, is complete streets and more safe, well illuminated cycling and biking paths. Thanks. Thank you.
Wonderful. Thank you.
So a couple more slides here, and then we're just going to briefly go through. We have a digital event guide, which we will be sharing out with the entire audience along with the recorded video. So May is, and we did not know this first one until the last week, May is National Bicycle Safety Month. So May is National Bicycle Safety Month. And as has been touched on, it is American Stroke Month, and it's also National High Blood Pressure Education Month. Next slide, Lauren. A few things about stroke, and Stacy, I think, touched on a couple of these. Stroke is the leading disabler of adults in our country. Stroke is our country's #5 cause of death, but globally, it is the #2 cause of death. High blood pressure, uncontrolled blood pressure or high blood pressure is the #1 preventable risk factor for stroke. And pets, this is an ad lib, so I see the tiger. Lauren has tigers too, cats. So pets are amazing for lowering blood pressure, lowering stress. And I know your cat's name is Mr. Big, right? It's Mr. Big. Pets are good for lowering blood pressure and reducing stress. So, oh, there you go. Everyone's got pets. That's so awesome. So we want to reduce stress and lower blood pressure. As Stacy mentioned, 1 in 5 women will have a stroke. Blacks and African Americans are at a higher risk for stroke. Every 40 seconds, someone in the US has a stroke. There's an arrhythmia that some of you may have heard of. It's called AFib or atrial fibrillation. Those that have AFib are at greater risk for stroke. It's estimated 5 times greater risk for stroke if they have that arrhythmia situation, AFib. And as has been touched on, stroke is an absolute urgent 911 medical emergency. Call 911. But we have been saying for the last decade, there is incredible treatments and there is hope because stroke is largely preventable, it is treatable, it is beatable. There is the opportunity to prevent as many as 80% of strokes. Next slide, please. I'm just going to echo what Stacy already said about FAST. Our local sponsor, Go Well Health, is bringing attention to the FAST warning signs. So as Stacy so well presented and explained, we want everyone to know the FAST warning signs and share with family, friends, your networks. If everyone could know the FAST warning signs of stroke, that F is face, A is arm, S is speech, T is time is brain, call 911. So if you ever experience one or more of the symptoms or you observe them on someone else, call 911. Next slide, please. And so this is a little bit of a fun slide, and then we'll transition over to the event guide and briefly go through that. So we're 2 weeks away from CycleNation in the Jersey Shore. We actually have 3 CycleNation events happening in New Jersey, all within a few days of each other. So this one, if we were in person, we would be, as I said, we'd be on the boardwalk looking at the ocean, having a blast, enjoying the sunset. So we're 2 weeks away, and we've been encouraging people to ride on their own where they are, whether that's a real bike or a stationary bike or a Peloton, but ride where you are. But we're going to be sharing these with people to have a little fun with, to kind of pretend or believe they're riding at the shore the week leading up to the May 26th CycleNation event. So we came up with 4 different sort of fun shore rides with different mileage. Some of them are shorter, a couple of them are a little bit longer. So with a little bit of graphics, and even not exactly do we want to be tour guides, but we added a few things in ride here, some things to see in some of the different areas here. So we have a ride that you could take next week as you kind of practicing for May 26th from Freehold to Asbury Park. Freehold is Bruce's childhood hometown. There's some other sites to see. There's a ride from Seaside Heights to Asbury Park, that's 21 miles. A ride from Point Pleasant Beach to Asbury Park, that's 11 miles on the bike. Red Bank to Asbury Park is 10 miles. Ocean City, if you wanted to believe you were riding your bicycle for a really nice long ride from Ocean City to Asbury Park, that's 81 miles on a bike. From Sandy Hook in the state park, that's roughly 16 miles to Asbury Park. And lastly, if you wanted to next week do a 48-mile ride, pretend you're along the shore, you're going from LBI up to Asbury Park, that's 48 miles. So we did this for really fun, just a little bit of fun to share with our cycling audience, so that they can have a little bit of, oh, cool. Oh, neat. Thanks, Lisa. Thanks. So it's just a little bit of, have some fun next week leading up to the May 26th event. And Lauren, you can transition over now to the guide. And again, we'll just briefly touch on this in the interest of time, because we'll be sharing this with everyone if they don't have it already. So again, the event is on May 26th. This is sort of a how-to guide, how to do CycleNation, how to register a team, how to register as a cyclist on someone else's team. And again, we are locally sponsored by GoMo Health. Next one, yep. And there's Stacy. Stacy, our survivor spotlight and stroke champion. Next page there. And again, the next two, and Lisa, you alluded to this a lot. We have a lot of wonderful science and data and information about the incredible health benefits of cycling. The incredible health benefits of cycling. And most everyone knows, we are a science, an organization grounded in science, based in science. Everything we do is evidence-based. So I won't go through everything here, but bicyclists, our research shows, are 11 to 18% fewer heart attacks among cyclists compared to the general population. Consistent cycling can reduce weight and obesity. It can reduce stress and lower blood pressure. It can have an impact positively on reducing the likelihood of diabetes and cholesterol. So cycling is good for us. And as Lisa said, we can reduce smog and air pollution, get cars off the road, get us onto the pathways, the cycling pathways. Next page there, Lauren. And again, we have a lot of resources around brain health and stroke, just an incredible menu. This is just one of many, many pieces. This is in the kit. That's $7.95. Roughly 800,000 people in our country having a stroke each year. You see the fast warning signs, call 911, it's an emergency. Next page, Lauren. And then this is a recap page about the event, the CycleNation. We have a goal of trying to raise $50,000. We're around $13,000 right now, but again, we have a few more weeks. And we do know some additional money is coming for CycleNation. So we are on our way trying to get as close to the 50,000. Today is a rally to share information and get people riding and cycling and having a little bit of fun. Again, with the hope and idea that next year we will all be together on the boardwalk in Asbury Park. The May 20th to 25th are the fun rides. Just get out there and cycle and ride. Again, whether you're on your Peloton, your stationary, your real bike. And then on May 26th, we'll be riding where we are at dusk. We'll be riding where we are at dusk between 5:30 and 6:30 p.m. on May 26th. We want everyone just riding with your family, riding with your friends, riding at your local park, in your neighborhood, or in your living room, and that sort of thing. And then taking selfies, which we'll touch on in a moment, taking selfies, your sweaty, active selfies, and posting them and tagging them with social media. Next page, Lauren. This page will illustrate, if you're just starting to register a cycling team, how you do that. When you go to the CycleNation landing page, the URL, which we have been sharing with everyone, these steps walk you through how to register a team. The next one, Lauren. This looks similar, but the middle gray area is a team is already set up and you want to register as a cyclist. You want to join a team. You want to join a team. So again, you'll go to the main page, you'll see register at the top, but instead of starting a team, you're going to select join a team, and it only takes 90 seconds, 2 minutes to populate your information and get going. Next page, Lauren. We have an app. There is a free app for CycleNation. It is applicable to Apple or Android devices. Through the app, you can fundraise through the CycleNation app. You can also track your activity. You can track your cycling activity. We have some technical people that can help with questions or troubleshooting around the app. Most people tell us it's fairly easy, if not very easy, to download and use the app. So again, it's free. It can be used for fundraising purposes or to track your activity. Next page, Lauren. Again, here, it touches on tracking activity and the technical support and that sort of thing. Next page, Lauren. We have, again, the sweaty selfies and the rewards. If you reach, any of the cyclists reach different levels, by raising $100 or raising $1,000, there are CycleNation thank you medals that are sent to you as a small token of our appreciation for supporting stroke and brain health. And this event specifically focuses, the entire campaign specifically focuses on raising awareness around stroke and brain health. And the dollars that we raise from CycleNation help us fund research around stroke and brain health. So there are some little rewards. We want you to take sweaty selfies, share fast warning signs with people. And lastly, that top dog, if you have a pet, as we've seen today, if you'd like to take a selfie with your pet, and it doesn't have to be a dog, we like all animals, but your dog, your cat, your ferret, your parrot, whatever. We do a lot of education and messaging around the value and importance of pets, mental health and well-being, physical activity, reducing stress. So we also encourage you to please feel free to take a selfie with your pet and post it using that hashtag life is Y and J. And I think that's it. And this, again, this is illustrating what do we do with the dollars. This is a small piece of what we do with the dollars that we raise, some of the programs that we have going, again, reducing risk of stroke in women, how we're responding to COVID. We've been funding research focused on COVID. We set up with hospitals around the world a free data registry for COVID that hospitals can access for research. We're working on food security, blood pressure, tobacco and vaping. So this is what we do with the dollars we raise. So next page, I think that's it, right, Lauren?
Yep, that's it.
Okay, so that's really everything. What we will do, I don't know if anyone has any questions, but what we'll do is we're going to be sharing the digital event guide with a recording of the video, because we are talking to a lot of teams and an audience of 50 to 75 people involved in CycleNation. So we will share a recording of today's rally and the digital event guide with everyone that was invited today and that is participating. So thank you, everyone. So I don't just to wrap up. I just want to say thank you. We're really excited about this, even though it's a digital experience. We so enjoy bringing attention to stroke and brain health education awareness. I want to thank Stacy Quinn for sharing her personal story. I want to thank Lisa Lee for those great tips and information around safe cycling. And so with that, I think we'll just wrap it up and wish everyone a great rest of the day, and get out there cycling and have a great CycleNation the next 2 weeks and on May 26th. So thank you, everyone.
Thank you. Bye-bye.
Thank
Thanks, everyone.
you.
Thanks. Bye-bye.